Hello, welcome to this segment of Code Rhetoric with Tam Talk. Today we will be referencing ICD-10 Coding Guidelines, Signs, Symptoms, and Unspecified Codes. So our ICD-10 guideline for signs, symptom, and unspecified codes states that signs, symptom, and unspecified codes have acceptable, even necessary uses. While specific diagnosis codes should be reported when they are supported by the available medical record documentation and clinical knowledge of the patient's health condition, there are instances when signs, symptoms, or unspecified codes are the best choices for accurately reflecting the healthcare encounter. Each healthcare encounter should be coded to the level of certainty known for that encounter. So our ICD-10 guideline continues. So if a definitive diagnosis has not been established by the end of the encounter, it is appropriate to report codes for sign or signs and or symptoms in lieu of a definitive diagnosis. When sufficient clinical information isn't known or available about a particular health condition to assign a more specific code, it is acceptable to report the appropriate unspecified code. An example is the diagnosis of pneumonia has been determined, but not the specific type. Unspecified codes should be reported when they are the codes that most accurately reflect what is known about the patient's condition at the time of that particular encounter. It would be inappropriate to select a specific code that is not supported by the medical record documentation or conduct medically unnecessary diagnostic testing in order to determine a more specific code. Here in our first coding example, the assessment and diagnosis is pneumonia unspecified. In our book steps, we should locate pneumonia, and our ICD-10 code should be J18.9. Our rationale is the provider did not specify the type of pneumonia. Therefore, your code assignment should be unspecified pneumonia. If the patient had been diagnosed with, say for example, interstitial pneumonia, the ICD-10 code would change, and it would change to J84.9 because the provider was specific to the type of pneumonia the patient had. So in coding example number 2, our assessment and diagnosis, the patient presented with cough and fever. The physician instructed the patient to continue taking over-the-counter medication. He also stated that if the symptoms continue to persist, he will then order a chest x-ray. So our first step is determining the diagnosis for this encounter. Seeing that the physician did not provide a definitive diagnosis, the guidelines tells us to revert back to the signs and symptoms or the reason that allowed the patient to present for the encounter. So in this particular scenario, our diagnoses are cough and fever. So in our first book step, we're going to locate the ICD-10 code for cough, which is represented by R05. Our second book step is to locate the diagnosis code for fever, which is R50.9. So in our rationale, again, the provider did not specify the definitive diagnosis. Therefore, the coder should submit the signs and or symptoms as the final diagnosis. And in this case, the patient's diagnoses are cough and fever. So our coding tips are, if a definitive diagnosis has not been established, refer to your signs and or symptoms as your diagnosis. If the diagnosis is not specific, it is appropriate to assign the unspecified diagnosis. Always code to the highest specificity based upon the information and the medical documentation for the encounter. And as always, if you're in doubt, it is appropriate to query the healthcare provider. This concludes our segment on ICD-10 coding, signs, symptoms, and unspecified diagnosis codes. To learn more, please subscribe to my website at www.abrahammedicalcodingcoachllc.com. And while you're there, please check out our blog entitled What's the 411 with Coding. My contact email is abrahammedicalcodingcoach@gmail.com. Thank you.